We have, as far as the African region is concerned, we have 3 African countries that have now confirmed cases. One of them is Egypt, which is on the African continent, but is within WHO, looked after by our Eastern Mediterranean Regional Office. And then we have 2 African countries, Algeria and Nigeria, that have confirmed cases. That simply, if you like, sharpens the level of concern, heightens the work that is happening to build countries' capacities to be prepared to address this outbreak. Our member states have done a lot of work in the last month in order to build up this preparedness, starting, first of all, with establishing diagnostic capacity. At the beginning of the outbreak, we had only 2 laboratories that were able to diagnose this virus. As we speak now, I think we have about 33 laboratories that have worked with support from WHO. And I have to say that we have built this upon a laboratory network on influenza that was already existing, that had been established to deal with the previous flu-like virus outbreaks that happened in the past. We already had a number of laboratories which were carrying out surveillance for influenza viruses in the region, and it simply needed then additional training of the healthcare workers and the kits that are specific to this virus to be put into place. In some countries, they've had to buy equipment. They've had to, of course, procure kits, train healthcare workers, train the laboratory technicians, and we expect that in the next couple of weeks, we should have all the countries able to diagnose this. This is extremely important because the sooner the diagnosis is made, then the sooner that the measures can be put in place to contain the further spread of the outbreak. We are concerned at the global level by the fact that such a rapidly growing outbreak has caused or is causing a challenge in the availability of certain key materials that are needed, particularly personal protective equipment, things like gloves, masks of the right type to be protective, particularly for healthcare workers who may be the first to be exposed by somebody who feels ill and reports at a healthcare facility. So there's a lot of work going on with partners to promote and stimulate production, expansion of production of these materials, and ensure that countries that may have challenges in terms of resources are also supported by WHO to be able to have supplies of these materials. So just to say that there is a global movement ongoing. The WHO Director General has established contact with key partners, briefs the UN General, the leader of the UN at the global level regularly on what is going on, is working with different partners to really try to mobilize all the support possible for countries. Member states have themselves put in place their own mechanisms for coordinating their response, are starting to implement different components of a response and ensuring that they have rapid response teams ready, diagnostic capacity being put in place, case management being organized, point of entry screening of travelers being organized. And I have to say that it is through point of entry screening at airports mainly that some of the cases have been discovered, have been screened and confirmed in countries worldwide, including in the African region. So we're here expecting by the end of tomorrow to have agreed a plan with our regional partners of who will do what, who will lead what component of the support to countries to make sure that we are prepared on the African continent and our countries build up their capacity to respond to this outbreak.